Nobody told me my body would become a stranger. That's the part they leave out. The books, the doctors, the well-meaning daughters, they talk about the knees, the blood pressure, the memory. But nobody sits you down and says, at some point, the most private part of you is going to change so completely that you'll stand in your own bathroom wondering what happened. I'm Beyonce, 65, retired nurse. And I'm saying the thing out loud that most women my age are only thinking quietly. Because here is what I've watched in hospitals, in clinics, in waiting rooms full of women over 50 who all came in wearing the same embarrassed look. Women who spent decades taking care of everybody else and completely forgot to take care of themselves down there. And they paid for it, silently, painfully, unnecessarily. When is the last time you actually thought about your intimate health? Not a checkup someone dragged you to. Not something a symptom forced you to address. But actually thought about it as maintenance, as care, as something that deserves your attention the way your heart does. I'll wait. If the answer is I can't remember, this video is for you. If the answer is I never really think about it, this video is especially for you. After menopause, estrogen drops. That part everyone hears. What they don't explain is what estrogen was actually doing all those years. It wasn't just about cycles and fertility. Estrogen was maintaining the tissue, keeping it elastic, moist, thick, protective. When it drops, and for most women, it drops fast, that tissue starts to thin, to dry, to become fragile in ways that make even ordinary daily movement uncomfortable. This condition has a name: genitourinary syndrome of menopause, GSM. Most women have never heard those 3 letters. Most women just know something feels wrong, and they say nothing. I had a patient once, 71, sharp, funny, completely in control of her life in every visible way. She came in for a blood pressure follow-up and mentioned, almost as an aside, I've had some discomfort when I walk for about 3 years. 3 years. She'd stopped her morning walks, stopped dancing, which she'd done her whole life. Her husband thought she was depressed. She thought she was depressed. It was severe vaginal atrophy, completely treatable, fixed within months. 3 years of her life adjusted around a problem with a straightforward solution, because nobody had ever told her this was something to watch for, because she'd been taught, the way most of us were taught, that this part of your body is not something you talk about unless something is seriously wrong. By the time she came in, something was seriously wrong, because she'd waited. So what does ignoring it actually look like? It starts quiet, a little dryness, occasional discomfort you explain away as soap, as fabric, as anything else. Then recurrent infections, UTIs, bacterial vaginosis that seem to come from nowhere and keep returning. Your immune system isn't failing. Your tissue is just too compromised to defend itself. Then the bladder joins in. Urgency, leaking, getting up 3 times a night. You start planning routes around bathroom locations. You stop laughing too hard at things because you're afraid of what happens. And somewhere in all of this, the dryness, the infections, the bladder, something quieter happens too. You stop feeling like yourself. That part of you goes from something ordinary, something you barely thought about because it just worked, to something you manage, something you work around. That's not aging, that's neglect, and the difference matters. Here is the simple version of what actually helps. Vaginal moisturizers, not lubricants, actual moisturizers used regularly, 2 or 3 times a week. Maintain tissue health the same way you'd moisturize dry skin anywhere else. This is not a medical procedure. This is maintenance. Pelvic floor exercises, done consistently, not occasionally, 10 minutes a day. They reduce urgency, reduce leaking, support the whole structure. You can do them in a chair watching television. Talk to your doctor about local estrogen, not systemic hormone therapy, local. Applied directly, stays local, restores tissue thickness, dramatically reduces infections. The research on its safety is solid. Most women who need it don't get it because they never ask. They never ask because no one told them to. And movement, physical intimacy with a partner or alone, maintains blood flow to the tissue. Blood flow maintains health. Use it or lose it is not a metaphor here. It is clinical reality. I'm 65. I've watched women older than me move through their 70s and 80s with full, comfortable, dignified lives. And I've watched others, smart women, careful women, women who took perfect care of themselves in every visible way, shrink quietly around this one thing they never addressed. The difference was not luck, not genetics. It was whether they decided this part of them deserved attention, whether they decided they were worth the slightly uncomfortable conversation. You are allowed to go to your doctor and say the thing out loud. You are allowed to put the moisturizer in your cart without apologizing. You are allowed to maintain the body you're living in, all of it. Because ignoring intimate self-care doesn't stay quiet. It spreads into your walking and your sleeping and your laughing and your confidence. And you don't get those years back. Start now, not next month, not after the next checkup, now. If you want more honest conversations like this that nobody else is having, hit that join button and become a channel member. You'll be part of a community where we talk about the real things.